Hi, everyone. Hope you're doing well. Thank you for joining us tonight. My name is Blair Budd, and I am the director of the One Health Academy. As you may see from our slide, hopefully this is coming up for you guys. Tonight, Tonya and I are presenting. So Dr. Tonya Nichols, and myself will present at 50 Years of the EPA. I am just going to go over a few things tonight before, it's a little non-traditional because we're given the presentation instead of hosting. So we're going to ask for thanks for your patience in advance and hope everyone can hear us okay. For questions tonight, because we'll be running and presenting at the same time, we won't be able to get to questions until at the end. So thanks for holding on to those until we can get to that, and just use the question feature or the chat feature. We'll check on both at the end of the presentation. So thanks for bearing with us. And I will go ahead then, and for the sake of presenting, I have to shut off my video so I can see the screen. So hope you guys are all hanging in there, staying healthy and enjoying the holidays. Hopefully there's some rest and leave for everyone on the horizon if you haven't already started celebrating. All right, let me go ahead and close this, and we'll go ahead and get started. All right, Tonya, are you with us?
I'm here.
Awesome. Okay. Great. So without further ado, here we are starting the U.S. Environmental Protection Agency, 50 years of One Health. Again, for those that have just joined us, I am Blair Budd, and I am co-presenting with Dr. Tonya Nichols. And we are excited to represent the environmental sector of Human, Animal, and Environment One Health collaboration. So always trying to represent the environment sector and keep these people at the table. So we have a lot to cover tonight, but only want to touch base on some key areas based on our time restraints. So we're going to do the best we can to kind of summarize some important pieces of the 50 years of progress that EPA has done. It's definitely a milestone year. And as many of you may know, EPA was established in December of 1970. And the goal was to consolidate into one agency a variety of federal research, monitoring, standard setting, and enforcement activities to ensure environmental protection. And since its inception, EPA has been working for a cleaner, healthier environment for the American people. And Tonya and I wanted to talk about all of the great progress that we've made. So we will start by taking a quick look back at the history. But before that, we'd also like to have a disclaimer that this presentation is the opinion of the authors, Tonya and I, only, and does not represent EPA policy, regulations, or positions. And Tonya has been in the Office of Research and Development for 17 years. I have been in the Office of the Chief Financial Officer for 4 years. So we are excited to kind of touch base on some of the things based on our experiences. And we'll take a step back first before we talk about the here and now. The American conversation about protecting the environment began all the way back in the 1960s. So Rachel Carson had published her Silent Spring in 1962, addressing the indiscriminate use of pesticides, and concern about air and water pollution had spread in the wake of several disasters, as you can see here. On the right-hand side of the screen, the Cuyahoga River in 1969 in Ohio became so polluted that it caught on fire. And that fire helped spur an avalanche of water pollution control activities, such as the Clean Water Act and the Great Lakes Water Quality Agreement as well. And by bringing national attention to water pollution issues, the Cuyahoga River fire was one of the events that led to the creation of the Federal Environmental Protection Agency, as well as the Ohio Environmental Protection Agency. So not to leave out air, you can see that picture of smog on the left-hand side. There was a need for national air quality and auto emissions and anti-pollution standards. So that was definitely a reality that many of you might remember. And there was also a need to restore and maintain our nation's water by preventing pollution, providing assistance to publicly owned wastewater treatment facilities, and also maintaining the integrity of wetlands, as you can see on the picture on the right with the fish. So the fish kills. So general sentiment, all to be said looking back, is that people were tired of these problems and the negative impacts they had on their health. So it was much needed in 1970. And so what you can see here, if you're not familiar with the mission of the EPA, the mission is to protect human health and the environment. And that's pretty tangible in that the EPA safeguards our air and our water we consume every day and the land that we use. So there are many ways that EPA is able to accomplish these protections, such as designing and enforcing regulations, grants, study and research efforts, several partnerships in education and information sharing, and that network that is created through that. And in these interactions and these networks, One Health comes into play. And you can see that here because on the right side of the screen, this is the One Health federal definition, and with the key foundational pieces of communication, coordination, and collaboration. So it's pretty easy to see how EPA's mission is connected to the One Health framework and everything that incorporates One Health. They really can't be mutually exclusive. And to be able to protect both human and environmental health, as well as the animals that we share within the environment, these foundational pieces are quite essential. And you really can't do EPA work without doing One Health work. So we'd like to highlight that. And so this lovely animated slide here helps touch base on the overarching mission of the EPA to safeguard the environment. This graphic also helps demonstrate how wide-reaching these efforts really are. So you can see in the middle there, on rotation, the three areas of the EPA's main functions: to research, to regulate, and to respond for all of those surrounding areas in the circle, and then further out, air, health, science, water. But what's important about these three key functions is that they impact each other. So you have research to support the regulatory piece, research to respond to cleanup and land waste, and to live greener. They're all interconnected, just like One Health. So there is so much here on this slide alone, as you can see in the detailed breakout in each section. And all of this is work that EPA does. But for our scope tonight and kind of what we want our key takeaways to be for you guys is the progress that we've made in two key focus areas of air and of water. And this is a huge mission space. So no, not only Tonya and I can cover everything, unfortunately, but if you have questions we can't answer, we'll make sure to help you find the answers. This presentation is to give a brief overview for both air and water. And we'll go ahead and move on to the water section. And thank you, Tonya.
Hi. So, well, I would like to just say that, I'm really proud to work for EPA, and it's made, a lot of progress over the last 50 years. And, if you look at the providing safe drinking water and treating wastewater, it's kind of hailed as one of the most important public health achievements of the 20th century. And I think it will continue to be so in the 21st century. And so, looking at this slide, it shows that EPA has made considerable progress. When EPA started in 1970, more than 40% of the nation's drinking water systems failed to meet even the basic health standards. But today, 92% of more than 147,000 drinking water systems meet all health-based standards. And, most people don't give water much thought. I mean, you take it for granted. When you turn on your faucet, you expect clean, safe drinking water. When you flush, you expect it just to go away. But EPA actually has been working on this, and we support the clean drinking water from the source to the tap. And we do this by protecting our source waters and setting drinking water standards. We've done that for over 90 contaminants. These contaminants might be microorganisms or pathogens. They can be disinfectants, disinfection byproducts, inorganic, organic chemicals that include pesticides and radionuclides. We also continue to review new contaminants. As you know, many of you have heard about PFAS. We look at new contaminants that might need to be regulated also. We've made considerable progress on 90, but there's many more out there that we will be looking at, or we still look at. So another way that the agency supports source water protection and drinking water is that we provide financing and funding for the critical water infrastructure. And so just like to highlight the EPA's, for decades, we have had a strong commitment to the state revolving fund, and that's helped project financing for drinking water quality infrastructure projects and all across the nation. So next slide. This is kind of basic what we learned in grade school about the hydrologic or water cycle. Rain and snow come down, and it either seeps into the ground and moves through streams and rivers to the oceans and back up to the atmosphere. And that's what we learned in grade school. But we need to look at how man has actually changed this cycle with urban development. Towns and cities have created a man-made urban water cycle to provide the drinking water to homes and businesses, to remove the wastewater and sewage, and redirect the stormwater into waterways. And it's interesting to note, if you look at all those buildings there, the water is the largest mass influx or flux into and out of cities. It's more than all the food, freight, people, or anything else that goes in and out of that city. It's water. So that's kind of an interesting thing. Where do you get all that water? If you look in the center of the diagram, it's usually the surface waters. They're the most visible that and it's surface waters being the lakes, the rivers, the reservoirs, and that's what's tapped for most public water supplies. However, the choice of a water source depends on many factors, including, well, how dirty is that water to clean? You know, what's the quality of that water? The availability of that water, how much is there? The proximity, how close are you to getting it to the city or getting it to the treatment? Economics, how much is it going to cost to actually clean that water? And then who owns the water? Who owns the waterway? And so there's legal issues. So if you look to the right of this diagram, before water, water is sucked up from the from the source water, but before it can be distributed throughout the city for human use, it's got to be treated. It's got to be cleaned, and it's going to be cleaned to remove the contaminants and the pathogens. So it goes back to how clean is the water to begin with. So the design of the treatment processes depends, again, on how clean the water is at the start, what you're starting with. At the most basic level, disinfection is necessary to inactivate the harmful microorganisms. There are more advanced treatment processes that can involve a sequence of screening, settling, filtering, disinfection, chemical adjustments like pH, adding chlorine at the water treatment facility. So once you have the clean water, on the left or on the right side of the diagram, then you need to go into the city, and it's got to be distributed through pipes, pumps, valves, storage reservoirs, and this is all under pressure. And while much of this is all buried and invisible, it's important to note that this system, you need it to be reliable and available when and where you need it. Goes back to that one of my earlier statements. When you turn on that faucet, you expect clean water to come out. And to give you some idea of magnitude of the network of pipes in any given city, you take DC, which is it's an urban city, but it's a pretty small city, and that little city has 1,300 miles of water pipes running through it. So it's a big system. So once you got the water in the homes and businesses, it gets used. The wastewater is collected in the sewer systems and transported to the wastewater treatment facility on the left side of the diagram. And so once it gets there, it needs to be treated with either physical methods, chemical or biological processes to remove the waste and the influent. And you got to restore that water quality, because once it's treated, it's going to be discharged back to the rivers, lakes, streams, wherever it's going. And as we know from a One Health perspective, we have animals and fish and sea life and wildlife that need to drink that water. So looking at the top of that diagram, you look at the rainwater. It could be snowmelt, and that's referred to as stormwater to the urban. Once you add that, you've got to manage that. When stormwater is absorbed into the soil, it's filtered and ultimately replenishes the aquifers and flows back into the rivers and streams. That's good. However, when it's so heavy and the ground's saturated by water, the excess runs through the city and into the storm sewers and road ditches and can carry the debris. Whatever's on the ground, it can carry debris, chemicals, bacteria, pollutants, pesticides, and it just carries it right back to the streams, rivers, lakes, and wildlife. And then also in that city, you have impervious surfaces such as pavements and roofs that prevent the rain or snow from seeping back into the ground. And again, the water runs quickly through the city and it can cause flooding and erosion. And also you have a problem if it's combined, where you have combined sewer and wastewater, and that can cause an overflow. So, one of the things that, we think that we're doing really well with adding development standards such as widening the streets, expansive parking lots, and artificial draining systems. However, they may produce more runoff than residential developments of 60, 70 years ago. These curbs are commonly used to channel stormwater, and that makes sense in an urban setting. However, when you take that to the rural or suburban areas, these systems can impede the movement of small animals. And once the small animals are on the road, like turtles, frogs, salamanders, they can't climb those curbs. So they travel along the curb and drop into the grate and fall in. And so you can also, it's damaging to the wildlife. So the next slide. So I selected some examples of waterborne contamination disease outbreaks to highlight the One Health connection between the source and drinking water to human and animal health. As most health professionals, when I began my studies, I learned about the cholera epidemic in London in 1848, in which John Snow mapped the disease source to the Broad Street pump. Once he removed the handle from the pump, he removed access to the contaminated water, and the epidemic was stopped. Great, good success story. And it's one of the best stories of public health. And so let's go about 150 years later. You go to 1993, and 400,000 people were sickened by the intestinal parasite in Milwaukee, intestinal parasite Cryptosporidium, and it was done in Milwaukee. And the source of this outbreak was attributed to agricultural runoff that overwhelmed the treatment facility. And even in that same year, 1993, their dead birds trapped in a water reservoir caused an outbreak of salmonellosis. And so there's other examples. If you look down, you can kind of go through. It's either a sludge runoff, a chemical burn, a pH issue. It could have been a storage like the Elk River, harmful algal blooms. All of these are, somehow connected to the pollutant that actually gets into the system. And that's what the graphic to the right depicts. How can we, how are our source waters becoming contaminated by human, industrial, and farming practices? So next slide. And this is just an example. Your older cities, many of your older cities like Chicago, DC used to have it, and they're working on is a combined sewer system where the stormwater and the sewers are combined and they go into one pipe. And in a heavy rain, it can overflow. And this is exactly what they think happened with the Cryptosporidium outbreak. city planners and newer cities, younger cities are definitely trying to separate the storm and sewer systems. So that just shows you that. Now I added this slide to highlight that the U.S. has an aging water infrastructure. And according to the American Water Works Association, there's about 240,000 water main breaks annually in America. And for every pipe that needs to be replaced, the cost would reach up to about $1 trillion. And that's the American Water Works Association. When you talk to the American Society of Civil Engineers, they think it's more like 3.6 trillion. So if you look at this, this watermainbreakclock.com, it's a running tally of all the water mains that are happening in North America. And so as you can see on the day I did this screenshot, 561 had happened that day. And the costs are just astronomical in repair cost and corrosion cost. The other thing I want to point out, we're talking about infrastructure failures. Well, what happens during natural disasters? There are infrastructure failures. Hurricanes, flooding, drought, earthquakes, many times damage the water systems. And the necessity for water is never more apparent than during a disaster. And COVID, a pandemic, has even highlighted that water infrastructure personnel are now considered essential workers. Next slide. So far, we have only talked about how the drinking water, wastewater, and stormwater is part of to me, it's the most fundamental system to help in the prevention of disease. But we need to switch gears, not only prevent the disease, but can we monitor and forecast disease outbreaks using and looking at wastewater? Because every home has a toilet and it all goes to the wastewater treatment plant. And so why not use wastewater-based, a new technology called wastewater based epidemiology. And it's not to be used by itself, it's to complement your disease surveillance systems and your early warning systems. And it's not, you can't use it by itself, but you can use it to analyze a community and a population's wastewater. And when you combine that with what the infectious disease stats, the goal is that you can monitor a whole community at a community level in real time. And so what would you monitor? You would take the sample and test using biological markers such as DNA or RNA for a particular pathogen, maybe an antimicrobial resistance gene. You could use chemical markers to test for pharmaceutical metabolites and endocrine disruptors. There's numerous benefits of wastewater sampling, but the collection and interpretation, we have to recognize it's an emerging field. Although the Global Polio Eradication Initiative's been using it for several decades, to look at the polio vaccine efficacy and coverage, it still is in a development stage. And one of the things that is the problem is there's no real standards on how to take the sample and how to take the sample, being sample collection strategy, and then once you analyze it, because we're not talking about clean water, we're talking about a pretty dirty sample. So next slide. So it is being used in SARS and our COVID-19. Patients or infected individuals with SARS-CoV-2 shed the virus in the stool, and the samples, it's being used across the country. It's actually being used globally. Retrospectively, it has shown that the virus is present in cities several months before large outbreaks have been recorded. It also shows that there's a correlation between quantitative RT-PCR data and the reported incidence of cases. And unfortunately, it also shows that the presence of the virus SARS-CoV-2 is in wastewater is ubiquitous. It's everywhere. But looking at the analysis interpretation of wastewater samples is quite challenging, like I alluded to. There's not a real standard analytical method and sampling strategy. So what does a positive sample mean? One positive sample merely suggests that at least one individual has shed virus upstream from the sampling site and does little to inform at the community level. But if you add that, say quantitative data like quantitative PCR and longitudinal sampling from the same site, you kind of start to gain patterns. And but however, if you look at how it's being implemented, the interpretation of positive samples can vary by who's analyzing it, and it can, but the goal is to see if it's being imported into the community or if it's a continued infection in the community. So next slide. So I hope that next time you turn on the faucet or flush, you'll have a greater appreciation of the work behind the scenes to keep the water infrastructure functional. It's not an easy job. And also, how does it relate to One Health? And then you say, well, okay, it relates, and why are we talking about it today? What can we do at an individual level? I mean, we could have a whole talk on practicing One Health behaviors for water protection. But if you look at the individual level, one simple thing is to pick up pet waste. Pet waste is one of the major contributors of stormwater pollution. During rainfall, pet waste left on lawns and beaches and trails and sidewalks, they wash into the storm drains and right into the water and could into the water bodies. The waste carries pathogens, and a single gram of dog waste can contain 23 million fecal coliform bacteria. So again, if people would recognize that it's not just picking up pet waste is more than just a nuisance. It actually is for the health of the water. Community level, again, it goes back to picking up the trash before it gets swept into the sewers or source waters. Government, we need our government to fund and support the infrastructure repairs. Globally, goes back to trash. You've got to clean up those rivers and streams before the trash, primarily is plastics, gets swept into the ocean that accumulates, and then it slowly degrades into the microplastics. So we all play a part in keeping our water safe. It's not just the EPA's problem, it's all of our problem. And then we can all practice One Health behaviors, our water will be safer. Next slide.
All right. Thank you, Tonya. That was a really great coverage of water. And now for the second half of our presentation, we're going to go over the progress that EPA has made with air. So as you can see here, and looking back at the progress that's actually been done for the nation's air, starting in 1970 up until 2020 this year, we've done a lot in a lot of really important key areas. And when EPA was created, its focus in the early 70s was to reduce emissions from passenger vehicles, which represented the majority of vehicles on the road, just as they do today. And EPA acted swiftly to reduce pollution from automobiles, setting emission standards that led to the introduction of the catalytic converter, and also initiating the phase out of leaded gasoline. And standards to curb emissions from medium and heavy duty trucks, which are mostly powered by diesel fuel, have also been key to achieving major air quality improvements. The NOx standards, or oxides of nitrogen, for trucks and buses were set in the early 80s, following in the 90s with strict limits on the sulfur content in diesel, and which resulted in significant environmental and public health benefits. So moving along that timeline there, throughout the 2000s, trucks got even cleaner and more fuel efficient, and new stringent particulate matter and NOx standards were issued for heavy duty engines, and that was effective in 2007. And then EPA launched SmartWay, which is a public-private partnership with trucking companies and shippers that shared a goal to cut fuel use and improve freight sustainability. And EPA and the Department of Transportation collaborated on a series of comprehensive greenhouse gas and fuel efficiency standards for heavy duty trucks. So as we look forward, with the EPA in the US and also globally, transportation is a huge, growing, large source of carbon emissions. And the rate of growth in emissions from freight-related activities is actually outpacing the rate from cars at this point. And carbon emissions are, as we know, a major contributor to climate change. And in the future, the EPA will continue its partnership with the transportation industry to reduce carbon and other emissions harmful to the environment and to human health. And we anticipate that significant advancements in electric truck technologies, vehicle connectivity, and logistic automation will transform the freight industry as we know it today, making it cleaner, more efficient, and resilient. So those are some items from the past and as we look forward. And since we're focusing on air, oh, sorry, we're going the wrong way. Apologies. We have actually here, this is an animation, so I'm going to go ahead and start this. All right. So this is an active air pollution source and effect system. What could possibly go wrong? This graphic can demonstrate that air pollution consists of gas and particulate contaminants that are present in the atmosphere. So you have gaseous pollutants, including sulfur dioxide, the NOx, oxygen, carbon monoxide, volatile organic compounds or VOCs, and certain toxic air pollutants, and even some gaseous forms of metals. And particle pollution, which is commonly known as PM 2.5 and PM 10, includes a mixture of compounds that can be grouped into 5 major categories, and we'll kind of get into that in a bit. But these sources are displayed on the left-hand side of this interactive graphic. And following this circular chain that you can see at the top there, some pollutants are released directly into the atmosphere, while other pollutants are formed in the air from chemical reactions. So you have ground level ozone forms when emissions from NOx and VOCs react in the presence of sunlight, and the effects are on the right-hand side, which show that haze and deposition create negative health effects for humans, animals, and the environment. And air is a One Health problem that you can see demonstrated through this, because we all require clean air to survive. And the question becomes, how do you measure this larger picture and the air quality itself? You first need to identify the contaminants, and you need the people or the manpower to be able to do this. So we're going to move on and look at what is actually being measured. So what's in the air that we need to measure that poses risk? The Clean Air Act requires EPA to set national ambient air quality standards, or the NAAQS abbreviated. These standards are established by the EPA and for 6 criteria pollutants, which is what you're looking at on the screen now. And these criteria pollutants are for outdoor air. And as you can see listed, they're currently set for carbon monoxide, lead, ground level ozone, nitrogen dioxide, particulate matter, and sulfur dioxide. So now we're going to explore how we actually keep track of these. One way is that air quality is actually monitored is through the Air Quality Index. And Air Now reports air quality using the official US Air Quality Index, and which is a color-coded index designed to communicate really whether air quality is healthy or unhealthy for you. And when you know the air quality index in your area, you're able to be informed and take steps to protect your health. And Air Now is a partnership of the US EPA with other groups like the National Oceanic and Atmospheric Administration, NOAA, with National Park Service, with NASA, CDC, and many other groups. But that's a collaboration of One Health proportions within itself. But thinking about this year and everything that's gone on with the fires, information from Air Now with the wildfires out west included current fire conditions like fire locations, smoke plumes, and air quality data from permanent and temporary air quality monitors. maybe some of you have used this website to see if it was safe to step outside. In addition to this partnership, EPA researchers have actually initiated a citizen science project called SmokeSense, which is a project to increase awareness of the known health effects associated with exposure to wildfire smoke. And it also has a goal of advancing scientific understanding of that relationship with health. So individuals who want to contribute to science can participate in SmokeSense by using the SmokeSense app, which is a free mobile app. And it's actually the first of its kind as a mobile app to evaluate health effects from wildland fires experienced by those who are participating in it, and to test whether health risks can be communicated effectively through resources and engagement delivered within that app. So some really exciting things going on, especially considering the needs going on this year and the changes in climate. So this slide demonstrates, okay, we've covered the sources of a lot of air contamination and pollution, but looking forward, some solutions, especially for transportation air pollution, emission reductions, it can lead to cleaner air and better health if we look forward. So you can see there, catalytic converters in conjunction with unleaded gasoline and lower sulfur levels significantly reduce hydrocarbon and nitrogen oxide emissions, which is great progress. And then for fuel standards, these can reduce exposures. Certain fuel standards can reduce exposure to pollutants like lead and even benzene, and renewable fuels reduce CO2 emissions. And then you have engine technologies like computer controls and variable valve timing and multi-valve engines, turbocharging and gasoline direct injection, improving fuel economy and reducing CO2 emissions as well. So certain transportation technologies like 7-speeds, dual clutch transmissions, and continuously variable transmission, CVTs, improve fuel economy and also are in an effort to reduce those CO2 emissions as well. You have diesel filters that can also reduce particulate matter from on the road and off the road diesel engines, and alternative vehicle technologies like plug-in electric vehicles and fuel cells equals actual zero tailpipe emissions, which is our goal, right? So better transportation planning for passengers and freight reduce emissions and fuel use, and that contributes to better air quality. But it's important to note the bigger picture here. So One Health helps us take on different perspectives, and with air pollution, this is no different. Everyone's health can be either positively or negatively impacted by the air they breathe, and globally, air pollution is considered a silent killer. So really, despite all I've just shared with you and the domestic scope and all our progress within the last 50 years, there's still so much work to be done both domestically and internationally. And air quality is a perfect One Health indicator if we were able to measure that. So you can see through the demonstration of the image of the map at the bottom that although we can be considered good in a sense, it's no way, shape, or form saying we're good enough, and to look at the global perspective, how much more work we have left to do, and really why One Health is so important to apply to not only EPA's work, but all health-related work in order for us to make a lot more progress that is much needed. So here we have the EnviroAtlas EcoHealth Relationship Browser. And this is an example. This is a growing body of evidence demonstrating that ecosystems. So firstly, this is a product of EPA that is a perfect One Health example of the work we do. But really, the Environmental Atlas helps us see that there's a growing body of evidence demonstrating that ecosystems such as forests, wetlands, and drylands really can provide protection from both natural and man-made hazards. And the EnviroAtlas tool demonstrates the linkages between human health and the benefits provided by nature, and it's called ecosystem services. So for example, EnviroAtlas has been used to explore management options for improving air quality with roadway tree buffers. You can definitely check that out online. It's a great resource, and it helps kind of grasp a lot of the work that we do at EPA in a One Health lens. All right, I'll segue to you, Tonya.
Hi. So looking at this, we just celebrated our 50th birthday. 50 years on December 2nd was when President Nixon signed into made a policy that the EPA and established the EPA. I like the quote below because even the problems we had 50 years ago are not the same. We can't even use the same thinking we did 50 years ago. We have to keep being innovative. And this next slide, as we started looking at our 50th year, we went, our public affairs office actually went and looked through all the administrations, and I was really happy to see that it was Republicans and Democrats that really valued the EPA or valued the environment and went. And if you look through this slide, or this is a slide presentation, or that it has background music, it doesn't have words to it, but you'll see all throughout the administrations, different ones, how it lays the groundwork and our regulatory basis for protecting human health and environmental health. So I think we'll click.
All right. Thank you guys so much for tuning in tonight. That is the end of our presentation. We just really want to highlight and thank everyone for being here, for prioritizing the environmental sector of One Health and being interested to learn about the progress that we made. We understand that this is a brief overview of the many aspects of all the EPA work that goes on. So we're in no way doing it justice, at least not even air and water work, but there's so much that's going on there. We're really cautiously optimistic for the future and the progress that we continue to make. And I think it's important to look back at milestones like this and see where we've come from in order to help motivate us to continue to make a lot of progress for the future. So with that being said, Tonya, any final thoughts?
Nope.
I
appreciate everybody signing in. I know it's close to Christmas, and so thanks for listening.
Yes, thank you, everyone. I'm not sure if the questions are getting shared because my screen is, but yeah, I've pulled up some if you've asked questions. So one of them that I'm seeing now is, I'll go ahead and read, and Tonya, feel free to take a stab. So, does part of what EPA controls for and drinking water standards include antibiotic contamination?
Yes, I mean, we don't have regulations on it. However, we are doing research and working with, other water organizations to actually look to see if we can get standards, and we don't have regulations, but the Office of Water and Office of Research and Development are looking at it.
Right. Thank you for that question. And another good one that was left was, how closely does the EPA work with the CDC and or NIH? And I know a lot of Tonya's work's related to that.
Definitely with CDC, we, in my area, we work a lot with the zoonotic, I can't think of the, I'll tell you what we work on. We work on sampling methods for environmental sampling methods together. We work cleanup standards, whether it is, like ATSDR and EPA work together on looking at Superfund sites. And then for me, I work on biodefense. So we would, work with CDC on cleanup levels for after an event. We definitely work with them on all the emerging contaminants.
And I'll add, Tonya, that I think there's so much potential for more EPA work, at least interagency work. There's a lot of coalitions, there's a lot of calls, and I think that especially right now, there's, despite everything that Tonya mentioned, I think we can only improve the work that we do through increased collaboration. And so Tonya and I are definitely working to incorporate One Health in the work that we do, and education is a huge piece of that, because I think, as many of you may know, it's easy to describe how One Health work, what it is and how it contributes, but you have to introduce the concept to those doing that work in order for them to help understand and frame their work in the future in that way. So I think that's a challenge in terms of the policy side in order to help frame the work. But the partnerships that exist are strong, and we could use a lot more, and hopefully there will be more interagency work in the future. So thank you for that question. All right, and I'm not seeing, I do see a question about the last administration and how it's impacted, and how it's impacted the EPA work, and what does it look like for the future. So Tonya, any thoughts on that?
Obviously each administration is going to have their own priorities. The idea that I work in biodefense, and my work was, not necessarily as affected as other parts. I work in the Office of Research and Development. I don't work in the regulatory side. So I don't have a lot to offer on that.
Right. And since I'm in the Office of the Chief Financial Officer, I've seen a lot of the steps that have been taken, and I think we can't really make much of a prediction now, but transition teams are working, and we have, I think what I can respond to that and say is that there's a new strategic plan that's being developed, and really encourage folks that, that the strategic plans are 5 years, so there's a public comment period. Maybe as kind of a takeaway is to keep an eye out on that. That'll be developed within the next year with the new administration, and that shapes a lot of the work and the measures and the focus of the grants, and where the partnerships are focusing their energies. So would encourage folks that are interested to participate in the public comment period and try to track that progress and see, with this new administration and this change, where that might take us, and kind of, how you can have a say in the strategic plan, which will shape our future work. So thank you for that question. All right, I see a question all the way from, oh, okay. How do you engage social scientists in your One Health work?
I can say that we definitely use social scientists for the ecosystem services work. All of, actually in my area, we have 2 social scientists that even work on cleanup. I work in the Office of Research and Development mostly biodefense, and the idea that, we have, will people trust the government that they're cleaning up? Will they, what are the behaviors that they will, even in COVID, we're using social scientists to look at the behaviors associated with waste, and how you use gloves and how you use masks, and how the increase in plastics, and can you do a better job of communicating the need for waste management. That's a big deal. We talked about the water. People need to be conservative water. We need to make sure that they understand, wipes, nothing, you don't put things down the toilet that you don't need to. And now we have, just even the toilet paper shortages. I mean, so we are definitely using social scientists to look at how people treat the environment and how they want to protect the environment.
For sure. Thanks, Tonya. And
it's mostly on the ecosystem services work and social justice. I mean, your environmental justice issues. We have a lot of them working there.
Right. Yeah. And hopefully that work will continue to expand in the future. So we have a question all the way from Melbourne. Thank you for joining us. It is about international cooperation in the impact of disasters on the environment, examples, wildfires. So Tonya, can you speak to any of your work with the EMS and OLM work? I don't know if it's international, technically.
We have an Office of International OITA and
International and Tribal Affairs, right?
Mm-hmm. I'm not working in that area right now, so we could connect you to the office of the international offices.
Right. Happy to share those resources, and thanks, Tonya. I know domestically there's a lot of response work going on with the domestic fires, and in the Office of Land and Emergency Management, there's a control room at the bottom of my building that responds to disasters like that, and to hurricanes, floods. There's definitely a response group at EPA very active in domestic response to emergency situations like that. So whether they're connected on a national front, I can't speak on, but we'd be happy to provide you those resources. So thank you for your question and for joining us. All right, I am not seeing any else in terms of the questions, anything else for you guys. So we'll go ahead and gift you some time back, a whole 4 minutes. But again, thank you guys for coming out, and joining us remotely. We know things are challenging, especially with the busy holiday season. So whatever you celebrate this season, thank you so much for taking some time out to let us share some information with you about the EPA, and encourage you to participate. We'll follow up with those that are looking for those resources, and really everyone stay safe and healthy. And we look forward to touching base with you in the new year. So be well, and thank you again for joining us here at the One Health Academy.
Thank you.
Thank you, Tonya.
Thank you.